Good day everyone, I'm Mary Patricia Tria from BSN 14 and today I am going to perform physical assessment from the general survey up to the eye structure and visual acuity. So prior to any procedure, we must first perform the general preliminary procedures. This is to establish trust and rapport and of course as a preparation for the assessment. So first let us introduce ourselves and verify our client's identity just to make sure that we have the right and correct client for this procedure. Hello, good afternoon po. I'm student nurse Patricia from PLM. Pwede po bang matanong kung ano po ang pangalan at birth date nila?
Mary Ann Vitria, November 29, 1974.
Okay po. After that, to further establish trust and rapport, we can explain what we are going to do in simple terms. And then also what to expect and how our client could participate in this procedure. So, Mrs. Tia, nandito po ako ngayon para po mag-perform ng physical assessment. So, magtatanong po ko sa inyo ng mga ilang katanungan and mamaya po may mga papagawa po ko sa inyo mga ilang test. Okay po?
Opo.
Po. After that, we can now prepare all the materials and equipments needed for each assessment and make sure they are functioning well. So first, of course, we need an alcohol and some cotton balls and cotton swabs for disinfecting and hand hygiene. And then we also need a digital thermometer, a watch with second hand, a BP apparatus, a stethoscope for assessing the vital signs of the patient. And then of course, we also need a measuring tape for assessing the height of the patient since we don't have a stadiometer that could measure the height of the patient. Down here, we also have a weighing scale, a digital weighing scale, which could measure the weight of the patient. And then, aside from that, we also have a pen light, of course, for assessing the eye structure and visual acuity of our patient, together with the card, the cover, and the magazine, as well as the Snellen chart to measure the visual acuity of our patient. So all of those are the materials needed for our assessment today. So after preparing all of those, we need to also make sure that there is a proper lighting or adequate lighting within the room or area so that we could perform an accurate assessment to our patient. And then after that, of course, we need now to assess or position our client in an appropriate, safe, and comfortable position in according to the assessment. So since we are still at the introduction or we will be starting at the general survey, then therefore our client is only okay to be remain seated. However, later on as we proceed to our procedure, then therefore we will be asking our client to assume a specific position depending on the procedure or the assessment. So after that, we also need to provide or ensure the privacy of our client by either closing the curtains if we are in a hospital setting, or if we are in a room setting like this, we can close the door to ensure the privacy. So since the door is already closed, then therefore the privacy of the patient is already ensured. After that, we can also encourage our client to ask any questions or report any discomfort during the procedure. This could possibly clear out things or clarify all the procedures and also promote the comfortability of our patient. So, Mrs. Tria, if ever po na may katanungan po kayo, pwede po kayong magtanong agad sa akin. Okay po?
Okay po.
If ever din naman po mamaya na hindi po kayo komportable sa ginagawa ko, pwede nyo po agad sabihin sa akin.
Opo.
Okay po. And then after that, lastly, of course, we need to perform hand hygiene and of course observe infection control procedure just to prevent the spread of microorganism and of course the risk of transmitting infection. We can also use personal protective equipment if there is high risk of infection. However, since our patient right now does not have any infectious disease or any risk for infection, then therefore personal protective equipment would not be necessary. So after performing all of those general preliminary procedures, we are now proceeding to the first assessment, which is for the general survey. So there are actually 6 things that we need to assess in the general survey. So the first one is we need to inspect the overall physical appearance of our patient. So first, is it appropriate to her age? Or is her sexual development appropriate to her appearance as well as her age? So based here on her record, our patient is already 47 years old. So right now, as I inspect the overall physical appearance of the patient, her appearance is just appropriate to her age because since she is already 47 years old, it is only normal to have a few strands of white or gray hair, and it is only normal to have a few wrinkles that are observable within the face of the patient. So aside from that, based on the sexual development of the patient, since the patient is already middle-aged adult, then the sexual development of the patient is indeed fully developed, and it is visible or manifested in the physical appearance of our patient. After that, we need to assess the level of consciousness of our patient. So we need to identify if our patient is alert and oriented. So to perform that, we need to ask questions to our patient regarding her name, her date, time, regarding the date and time, regarding the location, as well as the situation. As you could remember, I have already asked the name of the patient a while ago as we verify her identity. So right now, I would only be asking the remaining questions. So, Mrs. Tria, bilang party po ng assessment, magtatanong lang po ako sa inyo. Alam niyo po ba kung ano po ang petsa, araw, at oras po sa ngayon?
Ngayon po ay June 11, 2021, araw ng Webes at mga alas 5 na po ng hapon.
Okay po. Alam niyo po ba kung saan po kayo nakatira?
Nakatira po ako sa Block 4, Lot 3, Phase Park, Casimiro, Westville Homes, Legazpi, Bacoor, Cavite.
Okay po. Nasaan po kayo ngayon?
Dito po ngayon sa ospital.
Ano pong ginagawa natin dito po ngayon?
Physical assessment po.
Okay po. So as you observe, the patient has answered all the questions correctly, then therefore our patient is alert and oriented times 4. After that, we can check for the skin color of the patient and facial features of the patient. Are there any observable abnormal skin color, like is the patient pallor, meaning namumutla? Is the patient, is there signs of cyanosis, meaning bluish ba si patient? Or is there any signs of jaundice, naninilaw ba si patient, that could indicate liver problem? But since as I observe my patient right now, there are no observable abnormal skin color because indeed, the skin color of the patient right now is lightly or slightly tanned. So therefore, the patient is not pallor, there are no cyanosis, or the patient is not jaundice. Aside from that, based on the facial features of our patient right now, there are no observable physical abnormalities or asymmetries. Instead, our patient has a near to symmetric face, then therefore there are no problems with the facial features of our patient. So moving on to the next assessment under the general survey, we need to inspect the body structure of our patient. So first, let us inspect the stature or the nutrition of our patient. So is the patient excessively thin, meaning sobrang payat ba ni patient, or is the patient obese, or just a normal or average stature? So based on those three, the patient right now has an average stature because our patient is not excessively thin to the point na butot balat na si patient, and also not obese na sobrang taba ni patient. So after that, we can also assess the symmetry of the patient. So in terms of symmetry, we can measure the arm span of the patient and later on compare it to the height of the patient just to identify if it is proportionate to the height of the patient. Aside from that, we can also identify, or just by looking or inspecting our patient, if the body parts of the patient or the limbs, the head of the patient are all proportionate to the body of the patient. As far as I observe my patient right now, all of her body parts, her limbs, her heads are all proportionate to each body part. So just to make sure that we have assessed the symmetry of the patient, we will be asking our patient to measure her arm span as we will compare it later on to her height. So, Mrs. Tria, sa ngayon po, okay lang po ba tayong tumayo? Okay? I-measure ko lang po ang inyong arm span. So, taas lang po natin yung kamay natin. Okay po. So, okay, straight body lang po. So, based on the arm span of the patient, it is 154. So, upo na po muna tayo, Mrs. Tia. So, later on, as we measure the arm span of the patient, we will compare it later on with the height of the patient. So, after that, we can also assess the posture of the patient. So is the posture of the patient erect or slightly stiff or tense, or is the patient's posture relaxed, or is the patient postures is slouch. So as right now, based on observing my patient, our patient has a slightly relaxed posture based on the posture of our patient. So right now she has a relaxed posture, and then aside from that, we can also assess the position of the patient. Is the patient supine? Is the patient sitting position? Is the patient standing? Or is the patient already in an orthopneic position that could indicate that the patient has a problem with a breathing or difficulty in breathing? So right now, the patient is in a sitting position, so we could record that. And then after that, we can also assess the body contour as well as the body build of our patient. So in assessing that, there are actually 3 classifications in terms of body build. The first one is what we call the ectomorph. When we say ectomorph, meaning the patient has a low body fat mass as well as the muscle mass, meaning the patient is excessively thin or skinny kasi mababa yung fat mass niya and yung muscle mass niya. Moreover, the second classification is mesomorph, in which it indicates that the patient has an equal muscle mass and body fat mass, or sometimes medyo mas mataas yung muscle mass compared to body fat mass. And then the third classification is the endomorph. So in the endomorph, it means that the patient has a higher body fat mass compared to the muscle mass. So right now, based on observing my patient, the patient is classified under the mesomorph. When we say mesomorph again, it means that there is equal mass of the body fat and muscles. So because our patient is not excessively thin or skinny, and also our patient is not obese, then therefore the body build of our patient is mesomorph. And aside from that, there are also no observable physical abnormalities or physical defects in the body of the patient. So we can now proceed to the next assessment or inspection, which is to inspect the client's mobility. So in assessing the client's mobility, we are checking the gait of the patient, or this is the balance and coordination between the movements of the patient, as well as the range of motion if the patient has a full range of motion or a limited range of motion. So to assess that, we are going to ask our patient to walk and then turn around and then walk again right back to the original position. So Mrs. Tria, okay, tayo po muna tayo. Lalakad po muna tayo hanggang doon. Ay, wait na po. Lalakad po muna tayo hanggang doon, then iikot po kayo, then balik po kayo dito. Okay po? Okay. So, as the person or as the patient walked, I have observed that the patient has a balance and coordinated movements, and the patient has also a full range of motion as she turned over, and she's also capable of walking alone. So, upo na po ulit muna tayo, Mrs. Tia. Okay po? So, after assessing the client's mobility, we can also assess any signs of distress in behavior of the patient. So, first, let us check the facial expression of the patient and any mood and affect. So, is the facial expression of the patient appropriate to the situation, or have we observed any sudden changes with the facial expression of the patient? So, as I have observed my patient a while ago, as we start the assessment and as the patient entered the room, I have not observed any sudden changes with the facial expression of the patient. And aside from that, the facial expression of the patient is just appropriate to the situation. So, aside from the facial expression and mood and affect, we can also assess the speech of the patient. So, is the patient's speech slurred? Is it clear? Is it understandable? Or the speech of the patient is also too fast? Is it too slow? Or is it only at the moderate phase? So, as I observe or as I converse with my patient a while ago, since kanina pa ako nakikipag-usap kay patient, I have observed that the patient's speech is understandable and clear, and aside from that, the patient's speech is also at a moderate phase or at a moderate rate. Therefore, it is not too slow and it is not also too fast. So after assessing the speech, we can also assess the hygiene and grooming of our patient. Does the patient looks neat, clean, has a maintained hygiene, well-groomed, and is there any body odor that we observe from the patient? So as I assessed my patient a while ago, as I have been assessing my patient, I have not observed any body odor. And then based on the physical appearance of the patient looks well-maintained hygiene, has a well-maintained hygiene, properly groomed, because I have also observed her nails are well-maintained and are short. And then the patient looks neat and clean. So after that, we can now assess the vital signs of the patient. So just to save time, we are going to assume that we have already performed or we have already assessed the vital signs of the patient. And to save the time of this return demonstration, we will be skipping the vital signs since we have already performed the return demonstration of the vital signs prior to this, and I have also another video of that. So after assessing the vital signs, assuming that we have already assessed the vital signs, we are now going to assess or measure the height and weight of the patient. So first, we are going to measure the height of the patient using a measuring tape. So remember, in measuring the height, we need to make sure that the patient is not wearing any slippers or shoes so that we could make sure that we are getting the accurate measurement. And we need to also make sure that our patient is standing straight and erect, so we could also ensure that we are going to get the accurate measurement or height of the patient. So Mrs. Tia, tayo po muna tayo. Kukunin ko lang po ang inyong height. Okay, tayo po muna tayo dito. Straight lang po. Okay? So to assess the height of the patient, since I am using a measuring tape, I will be using a mark to mark the height of the patient, and later on I will measure it through the use of the measuring tape. Okay po? Okay po, sige po. So, pumunta tayo. So I will be measuring the height of the patient in centimeters. Okay, so based on the measurement, the height of the patient is 155. So as you could observe a while ago, we have measured the arm span of the patient. The arm span of the patient is 154, and right now the height of the patient is 155. If you will observe, there are only one difference, or number one difference between the arm span and the height of the patient, and therefore the symmetry or the proportionality between the arm span or the limbs of the patient as well as the height is just proportional or normal. So after measuring the height of the patient, we are now measuring the weight of the patient. So whenever we are measuring the weight, we need to make sure that the patient is wearing a light clothing and does not wear any heavy accessories, so that we could make sure that the patient is, we could be measuring the patient's accurate weight. And then after that, we need to also make sure that once the patient have standed, or once the patient have stand or stood in under the or above the weighing scale, we need to make sure that the pressure or the weight of the patient would be both at the feet, and there are no bending or sideways between the body of the patient, so that the weight of the patient would not be altered. So, Mrs. Tia, isusukatin po natin yung weight natin. Tayo na lang po tayo sa weighing scale. Okay po. Diretso lang po. Okay, tingin po sa diretso. Okay, okay na po. So, yung weight nyo po is 53.6. So, isusulat ko lang po dito. So, the weight of the patient is 53.6. So, right now, since we have already assessed or measured the height and weight of the patient, we are going to compute the body mass index. Sige po, pupo muna tayo, Mrs. Tria. So, in measuring the body mass index, we are using a formula, weight over height squared. So, the weight should be in kilograms and the height should be in, of course, meters. So since we have measured the height of the patient in centimeters, we are going to convert that into meters. So the height of the patient is 155, therefore in meters it is 1.55. And then the weight of the patient is 53.6. kilograms. So what we're going to do, I'm just going to get a calculator, and then I am going to square the 1.55. So it is 2.40. So right now, 2.40, it will be divided to the 53.6, which is the weight of the patient. So 53.6 divided by 2.40. So the BMI of the patient is 22.34, which is already rounded off. So remember, there are following classification in the BMI. If it is 18.5 less or less than 18.5, it is underweight. But if it is 18.5 to 24.9, it is normal. And since the BMI of the patient is 22.34, then therefore, it is considered normal because it is within the 18.5 and 24.9 range. So the patient has a normal body mass index. So right now, we are already done in assessing the general survey of the patient, and we are now going to proceed to the next assessment, which is to the skin of the patient. So in terms of assessing the skin of the patient, we are going to assess 5 things. The first one is, of course, we are going to inspect for the uniformity of the skin color. If you will remember, we have already assessed the skin color of the patient. So right now, we are going to assess the uniformity of the skin color. So, are there any white patches? Because white patches could indicate vitiligo and albinism, and where it is a disease, where it is a problem in a melanin that appears to be white patches or sometimes completely white. So as I observe my patient right now, there are no observable white patches, then therefore the patient does not have any signs of vitiligo or albinism. And then aside from that, we need to also inspect any vascularities within the skin of the patient. So in terms of vascularities, we need to observe any overly visible veins. So as I assess the arms of the patient, I observe some overly visible veins. Maybe it is due to stress of the veins, as the patient is always performing procedures or performing things that could or stresses the veins of the patient. So we could ask our patient for that. May naglalaba po ba kayo lagi? Or
Madalas po, 2 to 3 times a week.
Okay po. So, indeed, since the patient is always doing laundry or performing laundry, then therefore, it indeed stresses the veins of the patient, because in the arms and the hands of the patient, there are overly visible veins, as well as in the legs of the patient, as well as in the feet, there are overly visible veins. So, we need to record those, and then after that, we need to also assess for any varicose veins. So varicose veins are usually found behind the leg of the patient, usually in the behind the femoral and within the popliteal, as well as in the sural part of our body. Usually there are 2 kinds of varicose veins. There are spider webs that are varicose veins na locations lang or regions lang, meaning patchi-patchi na varicose veins. However, there is what we call reticular varicose veins, that are small veins or small varicose veins that could be found all throughout the legs. So, Mrs. Tia, okay lang po ba? Tayo po muna tayo. Okay po. We are going to ask our patient to stand so we could really assess the legs of the patient. So, as I assess the legs of the patient, I have observed that the patient has a varicose veins, most specifically reticular varicose veins that occurs in small varicose veins and all throughout the legs of the patient. Okay po, upo na po ulit tayo. And then after that, we need to also assess for any hemangiomas. So when we say hemangiomas, these are birthmarks or red birthmarks that underneath that there are accumulation of blood vessels. However, as I assess my patient right now, there are no observable hemangiomas, because those are just birthmarks or red birthmarks that has accumulations of blood vessels. So that happens usually in kids, but right now, since my patient does not have any of those, then therefore there are no present hemangiomas. Only the varicose veins and the overly visible veins. So aside from that, we can also inspect for any lesions. So are there any lesions in the skin of the patient? So far as I observe the skin of the patient, there are no lesions. We can also assess for any bruisings. May mga pasa ba si patient? So wala namang pasa si patient. And then lastly, we can assess for any tattoos if there are any. So obviously, there are no tattoos, and just to make sure, we can ask our patient if she has any tattoos. Mrs. Tria, meron po ba kayong tattoo?
Wala po.
Okay, so since our patient does not have any tattoos, then therefore we can now proceed to the next assessment. So the next assessment is to palpate any lesions. So if ever there is only any, but since wala naman tayong na-assess na lesions sa skinny patient, then therefore we would not be palpating any lesions. But if ever there is, we need to also take note the characteristics of the lesions. What is the color of the lesion? And aside from the color, we need to identify what is the shape, as well as the elevation, what is the proper location, what is the size of the lesion, as well as the distribution of lesion in the body, because that could also indicate a disease within the patient. But since our patient does not have any lesions, then therefore there are no problem with that. After that, the next thing we need to do is we are going to palpate the skin of the patient for temperature, moisture, thickness, and texture. So in assessing the temperature, we need to use the back of our hands since yung palms natin can generate their own heat, and of course, since meron tayong thick skin sa ating palms, hindi rin natin makukuha yung accurate measurement kapag yun yung ginamit natin. So we need to use the back of our hands. And whenever we are assessing, we need to assess both of the arms and the legs at the same time so that we could also assess the difference between the temperature of both the arms and legs of the patient. So Mrs. Tria, ipapalpate ko lang po yung inyong kamay. Okay. So right now, the temperature of the skin of the patient in both the arms and the legs are just the same, and it is not too hot and it is not too cold, it is just average. So after that, we can also assess for the moisture. So as I touched the arms and legs of the patient a while ago, it doesn't manifest any excessive dryness or excessive moisture, because we need to assess kung medyo matindi ba yung pagpapawis ni patient or yung moisture sa skin ni patient, or medyo matindi yung dryness ng skin ni patient. So as I assess kanina, wala namang excessive moisture or excessive dryness sa skin ni patient. Instead, sakto lang yung moisture ni patient, hindi siya super moist na to the point na basa yung skin ni patient, and hindi din siya super dry na rough and dry yung skin ni patient. So we have already assessed the texture of the patient. Again, hindi siya dry, hindi din siya super smooth, but just the right texture, meaning the average texture. Aside from that, in terms of thickness, we need to assess if there are any callus within the skin, because sometimes if the patient's skin is already super thick, then therefore it could possibly indicate also some diseases. But since as I palpate the skin of the patient a while ago, I have not assessed or I have not observed any excessive thickness within the skin of the patient. So after inspecting that or palpating that, we now need to perform or palpate, of course, the skin of the patient for its mobility and turgor. So what we need to do is we are going to pull and slightly pinch the skin of the patient, and then we should observe if it will spring back to the original position, and then if it doesn't, we need to take note of the time of how long it stays to be tented. Because usually, kapag yung skin turgor ni patient, it could indicate edema or some problems within the condition of the patient. So, Mrs. Tia, magpe-perform lang po ako ng skin turgor test sa inyo po, okay? Okay? So, as I perform the skin turgor test within the skin of the patient, this patient's skin springs back right ahead. So, therefore, there is no problem with the turgor of the patient, and there are no edemas or observable edemas with the skin of the patient. So, aside from that, if ever kasi na yung patient natin, ang nangyari is matagal siyang mag-spring back, it has a possibility na merong edema si patient. So, whenever the patient has edema, we can grade that from +1 to +4. So, +1 meaning the patient's skin turgor or a grading of edema, it springs back right ahead. And then +2 meaning the patient skin remains tented for at least 15 to 30 seconds. And then +3, which is the grade +3, the skin remains tented for about 1 minute, 1 to 2 minutes. And then of course +4 if the skin remains tented for 2 to 3 minutes. So after that, we are now going to proceed to the next assessment, which is the hair and scalp of the patient. So in assessing the hair and scalp, we need to assess 3 things. The first thing is we need to inspect the hair of the patient, its distribution, its color, its elasticity, as well as its texture. So Mrs. Lia, i-inspect ko lang po ang inyong hair. Okay po? So we are going to check for the, of course, distribution of hair. So far, the hairs, the patient's hair is equally distributed or evenly distributed. And then it is also smooth. Okay, the texture of the hair of the patient is smooth. And then the elasticity, the patient has somehow a brittle hair, which is easily torn. Mabilis maputol yung buhok ng ni patient. So therefore, it is somehow brittle. But so far, the patient's hair is slightly moistured, but also slightly dry. That is why it is easily torn or easily breaked. So that is the hair of the patient. And then after that, we need to also inspect for the scalp cleanliness. So the cleanliness of the scalp, we need to observe if we can see any dandruff or any infestations like lisa, kuto, and such. So to do that, we are going to slightly open the hair of the patient. We're going to part the hair of the patient. Okay, let's check for any dandruff or infestations. So remember to check it until the back of the hair of the patient, and to make sure that we cover all of the hair or all of the parts of the scalp of the patient. So as I observe the scalp of the patient, there are no dandruffs and there are no infestations within the hair of the patient. I have only observed that the hair of the patient has a few strands of white and gray hair, but mostly the color of the hair of the patient is black or dark brown. And then after that, we need to also palpate the scalp of the patient just to make sure that there are no masses or there are no protrusions or prominences. So to do that, we can run our hands through the scalp of the patient to assess any masses or any prominences. So i-run ko lang po, okay? Okay. So as I run my hands through the scalp of the patient, I have not observed any masses or any prominences. Okay? So we need to have our patient back. Okay? So after assessing the hair and scalp of the patient, the next thing we need to assess are the nails of the patient, in both the fingernails and the toenails. So there are 5 things that we need to assess in the nails. The first is within the nail plate. What is the shape and contour of the nail plate? So we need to identify if the nails of the patient has any clubbings. So when we say clubbings, is ito yung condition kung saan yung nail ni patient and yung skin ni patient has 180-degree angle, meaning flat na talaga, as in flat from the nail of the patient and then the skin of the patient, in which that could indicate any problem within the liver or anemia. And then aside from that, we can also assess for any spoon nail. So when we say spoon nail, meaning naka-depress yung nail ni patient, nakalubog siyang ganon, which could also indicate problem within the blood or the anemia and also liver problem. And then we can also check for any the shape, or does the patient nail has a convex curvature, meaning which is the normal curvature of the nail, which is pa-convex. And then we can also assess if she has a 160-degree angle, because the normal angle between the nail plate and the skin of the finger is 160 degrees. So, i-assess lang natin ngayon. Okay? Based on the nail of the patient, it has 160-degree angle. So, therefore, the patient does not have any clubbings. And the curvature of the nail of the patient is also convex curvature. And therefore, there are no spoon nail, any signs of spoon nail, or any signs of clubbing. So, we can also check the toenails of the patient. Okay? Okay, there are none. And also, convex curvature and also 160-degree angle within the nail plate and the skin of the patient. After that, we need to also inspect, of course, the consistency of the surface of the nail. So, in terms of consistency, we need to identify if the nail surface is smooth or are there any grooves or indentations. So, we need to check if there are excessive thickness, because usually, if there are excessive thickness, we can observe that the nail of the patient is yellowish. Kasi kapag yellowish na yung nail ni patient, meaning it is excessively thick. And then we can also observe for any signs of indentations or grooves, which is called the Buse lines. Because when we say Buse lines, it is a condition where merong indentations yung nail ni patient, meaning may mga lubog-lubog. And it could indicate a condition or a disease that is uncontrolled diabetes or any problem with the peripheral vascular system. So right now, as I assess the nails of the patient, it is smooth and there are no grooves and indentations. Okay? In terms of the toenails, there are also no grooves and indentations, and there are no signs of excessively thickness of the nails. So after that, we need to also inspect, the next thing we need to inspect is of course the color of the nail bed. So is there any pallor, signs of pallor, cyanosis, jaundice within the nails of the patient? So as I assess the nails of the patient, it is pinkish. Okay, it is pinkish. Therefore, there are no signs of pallor, cyanosis, and jaundice. And then the fourth thing we need to assess is of course the tissues around the nail of the patient. So we need to identify if the tissue around the patient is there any inflammation, swellings, or is there a hangnail? So yung hangnail, ito yung piece of skin that could be found somewhere near the root of the nail na mukha siyang nasira or mukha siyang napunit. So it is a torn piece of skin around the root of the nail of the patient. So let us check. Okay. So far, there are no hangnails. However, I only found one hangnail. So ito yung parang skin na slightly napunit dun sa may around ng nail ni patient. Usually, nasa root part siya. Okay. Usually, it is because of hindi siya properly or mali yung pagkakagupit ng kuko, kaya nagkakaroon ng hangnail. So, within the fingers of the patient, I have only observed one hangnail, and then within the toenails, I have not observed any hangnail. And then, of course, lastly, we need to perform a Blanch test or a capillary refill test. So, in this, we need to pinch one finger of the patient at both hands or at each hands at the same time to identify if the color would go back within at least 2 seconds or it would remain in that color for a long time. Okay? So, Mrs. Tia, ipipinch ko lang po, didiinan ko lang po saglit yung fingers nyo para po mag-perform ng Blanch test. Okay po? Okay? So, upon performing the Blanch test in both of the hands of the patient, fingernails, and both the toenails, the patient's nail bed color has go back to its original color right ahead, and then it does not manifest any length of time in going back to its original color. Because usually, kung matagal bumalik yung color ng nail bed ni patient, it could indicate cardiovascular disease or any disease that are related to the veins or cardiovascular disease or respiratory disease. So after that, after we perform the assessment in the nails of the patient, we can perform, of course, hand hygiene just to make sure that we prevent the spread of microorganisms because we have a direct contact with our patient. The next thing we need to assess is the skull and face of the patient. So in assessing the skull and face of the patient, there are 3 things that we need to assess. Of course, the first one is the shape, the size, and the symmetry of the skull of the patient. Because usually in infants, if our patient are infants, may malakas or common yun sa kanila yung hydrocephalus and microcephalus, in which hydrocephalus is the enlargement of the skull or the head of the patient, and then microcephalus or microcephaly is yung abnormally shrinking or maliit yung ulo ni patient. Usually sa mga infants yun, but since we already have an adult, middle-aged adult patient right now, it is not possible to have hydrocephalus or microcephalus. So, based on the size or shape of the skull of the patient has a proportionate size of skull with the body, and then has a round skull, and then it is symmetrical. Therefore, I have not observed any asymmetries from the skull of the patient. And then the next thing we could do is, of course, palpate the skull of the patient just to make sure that there are no masses, there are no prominences or protrusions that could possibly indicate lumps or tumors within the head of the patient. So, Mrs. Tia, hawakan ko lang po yung ulo nyo. Okay, papalpate. So, we can palpate the head or the scalp of the patient through our fingers, and then we can slightly move it or in a massaging manner just to really feel the scalp of the patient for any prominences or lumps. Okay? Make sure to assess also the back of the head of the patient or the skull of the patient to assure that we cover all the areas of the scalp of the patient. Okay? So far as I observe or as I palpate the scalp of the patient, I have not observed any mass, any lumps, or any prominences. So therefore, we can now proceed to the next, which is to inspect the facial features of the patient as well as the facial movements of the patient. So in terms of facial features, are there any asymmetries? And moreover, we need to also observe any the size of the face of the patient. Is there a moon face? Because when we say moon face, there are accumulated fats around the face of the patient. That is why yung mukha ni patient nagiging sobrang round. That depicts the shape of the moon. Moreover, we need to also observe for any involuntary movements, which is mga mannerisms or nagfi-flicker bigla yung eyes ni patient, or biglang may mga muscle tremors or nerve tremors within the dito sa may eyebrows or dito sa may lips ni patient. That could also indicate problems within the nerve endings or the nervous system of the patient. And then aside from that, we need to also assess for any droopings, meaning hindi ba pantay yung patient, yung mukha ni patient, yung isa nakalawlaw, yung isa nakaganto, so hindi siya pantay. And so far as I observe and assess the facial features of the patient, I have not observed any droopings or asymmetries. I have not observed moon face or any abnormal shape. It is round, and I have not also observed any involuntary movements. Then therefore, there are no problems with the facial features of the patient. So right now, we are now going to move on with the assessment of the eye structure and visual acuity of the patient. So in assessing the eye structure and visual acuity, which is the last assessment for today, we are going to assess 11 things in the eyes of the patient. So first, we are going to assess the eyebrows, the eyelids, as well as the eyelashes of our patient. So for eyebrows, let us check if it is evenly distributed. And then if there are any flakiness within the skin of the eyebrows, or so the base skin of the eyebrows. Can we observe any flakiness that can be indication of dryness in the skin of the patient? And then we can also observe the eyelashes of the patient. We can check if it is curled outwards or inwards, because usually the normal is it should be curled outwards. And then we can also check the eyelids of the patient. Are there any inflammations, swellings, redness that could indicate problems within the eyelids of the patient? So right now, as I observe the eyes of the patient, the eyebrows, the eyelids, and the eyelashes, the eyebrows of the patient is evenly distributed. There are no flakiness underneath the eyebrows. And then the eyelashes of the patient is curled outwards. And then there are no inflammations within the eyelids of the patient. So after that, we need to inspect also the anterior eyeballs as well as the sclera of the patient. So we need to assess if the eyeballs of the patient is fitted into the socket, meaning hindi ba siya nakabulge or nakabulge out, that could indicate exophthalmos. So when we say exophthalmos, it is a condition where yung eyes ni patient nakabulge out or parang nakaluwa. And then there is also a condition called strabismus, in which yung eyeballs ni patient hindi siya naka-center. So meaning yung isa naka-direct to the center, while yung isa naka-direct sa other direction, nakatagilid or what. So hindi siya pantay. And that is called strabismus. So as I observe my patient right now, there are no observable exophthalmos, meaning the eyeballs of the patient are properly fitted on the sockets, and then there is no observable strabismus because both of the eyeballs of the patient are directed to the center. So after that, we need to assess the palpebral and the bulbar conjunctiva. So the bulbar conjunctiva is the coating that could be found above the cornea, and then the palpebral conjunctiva is the one that we could found underneath the eyelid of the patient. So first, in assessing the palpebral conjunctiva, we can pull down the skin of the patient right here, so we can see the palpebral conjunctiva right underneath the eyelid of the patient. And then we need to assess for any lesions, for any redness, or as well as the texture of it. So, Ms. Tia, okay, i-assess ko lang po, ibababa ko lang po to. Okay, so far, the bulbar conjunctiva and the palpebral conjunctiva of our patient is pinkish. There are no redness, there are no inflammations, and of course, there are also slightly observable capillaries, which is only normal because usually we can really observe capillaries within the bulbar and the palpebral conjunctiva. So that is only normal. And I have observed that in our patient. So there are no abnormal texture. So after that, we can now proceed to the next assessment. So the next assessment, we are going to inspect, of course, the lacrimal glands as well as the lacrimal ducts and nasolacrimal ducts. So we can find the lacrimal glands here right in the eyelid near the outer canthus, and then we can find the lacrimal ducts here also in the lacrimal glands. We also have a lacrimal ducts there, and then we also have lacrimal ducts here near in the inner canthus, in the above and the below the inner canthus. And then we also have the nasolacrimal duct that could be found here from the inner canthus that runs along the nose. So we need to inspect for any swellings, are there any redness, or are there any inflammation within the lacrimal glands and lacrimal ducts of the patient, because that could indicate that there is a problem or obstruction within the lacrimal glands and lacrimal ducts as well as in the nasolacrimal ducts. So as I observe right now, the lacrimal glands, the nasolacrimal ducts, and the lacrimal glands or ducts, there are no problems or there are no inflammations or redness, and there are no observable inflammations and swellings. So after that, we can also palpate those just to make sure that we don't feel any masses within the lacrimal glands, lacrimal ducts, and nasolacrimal ducts. So, Mrs. Tia, ipapalpate ko lang po. So, first, let us palpate the lacrimal glands. Okay, pikit lang po tayo. Okay? Okay. So as I palpate the lacrimal glands, the lacrimal ducts and nasolacrimal ducts, I have not observed any masses, then therefore there are no obstructions or problems within the ducts and glands of the patient. After that, we can now assess or inspect the cornea of the patient for its clarity and texture. So to assess the cornea's clarity and texture, we can use our pen light. So to do that, we are going to ask our patient to look right ahead, straight ahead, and then we are going to run our pen light from an oblique angle and then run it across the eye of the patient. So we can identify the clarity and texture of the cornea because usually it should be smooth, it should be clear and transparent. And also we need to check out for any opaque. Is the cornea of the patient opaque? Because it could possibly indicate problems with the eye of the patient. Okay, Mrs. Tria? Tingin lang po kayo diretso, okay? Tataputan ko lang po ng ilaw. Okay. 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 So as I assess the eyes of the patient or the cornea of the patient, it is clear and transparent and I have not observed any opaqueness within the cornea of the patient. So after assessing the cornea of the patient, we need to also assess the pupil and the iris of the patient. So in assessing the pupil and the iris of the patient, we need to check out the size, the shape, as well as the symmetry of the pupils and the iris. So first, let us inspect if there is any signs of aniscoria. So when we say aniscoria, it is the abnormal size of the pupil of the patient. Usually, hindi equal yung size ng pupil ni patient. Therefore, yung isa, mas malaki yung pupil, while the other one has a smaller pupil. So after that, let us also check if there are any signs of myodiasis. So when we say myodiasis, this is the abnormal enlargement or dilation of the pupils of the patient. Aside from that, we can also check for any signs of meiosis because meiosis is also abnormally shrinkage or abnormally small pupils of the patient because usually the normal size of the pupil of the patient or the iris of the patient is around 3 to 7 millimeters. So right now, as I observe the pupils and iris of the patient has an equal size and round pupils and iris. So after inspecting the pupils and iris of the patient, I have also observed the color of her pupils, which is a dark brown. After assessing it, we are now going to inspect for the direct and consensual response of the pupil of the patient for the light and accommodation. So first, we are going to assess for the reaction to light. So in assessing for reaction to light, we must first get the room darkened a bit. So I am going to close the light. So Mrs. Tia, isasarado ko lang po muna yung ilaw. Okay, so since it is slightly dark, so we are now going to get our pen light and then we are going to flush the pen light or direct the pen light to the pupils of the patient. So we are going to check if the pupils of the patient or the iris of the patient is going to constrict because if the patient iris constricted, then therefore the patient's iris is normal. Okay? So Mrs. Tria, tatapat ko lang po itong pen light. Okay? Straight, diretso lang po ang tingin ninyo. Okay? 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 So based on the reaction to light, the patient's pupils or the patient's iris have constricted. Then therefore, it has reacted to light. So right now, we are going to assess for the reaction to accommodation. So to measure or to assess the reaction to accommodation, what we're going to do is we're going again to use the pen light. And then we're going to put it in front of the patient along the nose or the nose bridge of the patient, and then we're going to move it closer to the face of the patient slowly. And then we're going to observe if the eyes of the patient constricted or the pupils and the iris of the patient constricted. Okay, so Mrs. Tria, tingin lang po kayo dito sa may aking pen light. Focus lang po kayo sa kanya, okay? Okay. So as I perform or as I take the pen light closer to the face of the patient's pupils and iris or eyes overall or generally have constricted. Then therefore, the patient's eyes also reacted to the accommodation. So therefore, we can record the eyes of the patient or the pupils of the patient as PERRLA or PERLA, which means the pupils are equally round and reacted to light and accommodation. So right now, we can turn on back the lights so we can have the accurate assessment. So after performing that, we are now going to perform the confrontation test, which measures the peripheral visual fields of our patient. So to measure or to assess the peripheral visual fields of our patient, what we're going to do is we're going to ask our patient to close one of her eyes. Okay, after closing one of our eyes, we are also going to close our eyes, which is across the eye of the patient. And then we are going to ask our patient we are going to ask our patient to identify the finger or the number of our fingers at the sides that are placent to the 4 visual fields. So, Mrs. Tia, pikit po muna tayo. Okay, yung isang mata lang po natin, takpan po muna natin. Okay, open po ng mata. Itatakpan lang po natin ng isang kamay, yung isang mata. Okay. Okay, so as Mrs. Tria have covered her right eye, then therefore I will be covering my left eye, which is across the eye of the patient. And then after that, Mrs. Tria, ilalagay ko po yung kamay ko sa gilid and kailangan nyo pong ma-identify kung ilan po yung number doon sa aking daliri. Okay po? Okay. So, hindi nyo po kailangan tingnan yung daliri ko, kundi nakatingin lang po kayo dito sa aking ilong. Okay po? Okay?
1, 2.
Okay. So, tama. 1 and 2. Okay, next. I'm going to perform the other hand.
2, 4.
Okay. So, based on the assessment of the right eye, the patient have mistakenly answered for the one question, which is she answered 2, but the correct answer is 3. So, right now, we are going to assess the left eye of the patient. So, Mrs. Tria, ngayon naman po, takpan po natin yung left eye. Okay, sasagot po ulit kayo dun sa, i-identify nyo po ulit yung number ng daliri ko. Okay po?
1, 2.
Okay, and then for the other one.
1, 3.
Okay, so also within the right eye of the patient has also mistakenly answered the 2 of the questions, which is right here she answered 3, which is instead should be 4, and then right here she answered 1 instead of 3. So therefore, there might be a problem with the peripheral visual fields of our patient. So after that, we need to record all of those because all of those should be assessed further by the optometrist or doctor that is specialist in the eye. So after that, the next assessment is we need to inspect for the eye of the patient in terms of the 6 ocular movements or the extraocular muscle functions. So in assessing these 6 ocular movements, we are going to assess the different muscles around the eyes of the patient. So to do that, we are going to hold the pen light and then we are going to move that into the 6 visual fields or 6 fields or 6 directions. So whenever we are going to move here, we are assessing the superior rectus, and then whenever we are moving here, we are assessing the lateral rectus, and then whenever we are moving right down here, we are assessing the inferior rectus, and then whenever we are moving right here, we are assessing the superior oblique, and then whenever we are putting our pen light here, we are assessing the medial rectus, and then lastly, whenever we are putting our pen light here, we are assessing the inferior oblique. So right now, we are going to ask our patient to just stay or firm her head. Okay, freeze her head in the straight manner. Just looking at the nose of my bridge, the bridge of my nose, and then after that, I will place my pen light at the center, and I will move it in the 6 directions so that I could assess the 6 ocular movements of the patient. So remember that only the eyes of the patient should follow the pen light and not the head of the patient. So, Mrs. Tria, this time i-assess po natin yung 6 ocular movements nyo po or yung muscles po around sa inyong mata. Okay po?
Opo.
Ilalagay ko po itong pen light dito and kailangan nyo po siyang sundan gamit lang po ang inyong mata. Okay?
Opo.
So, hindi nyo po isusunod ang inyong ulo, kundi ang mata nyo lang po. Okay po? Okay, so ready? Okay. Mata lang po. Okay. Okay. So, since the patient has directed her eyes into the 6 directions, therefore, her 6 ocular movements are normal and functioning well. So, lastly, we need to assess the near vision and also the distance vision of our patient. So, first, to assess the near vision of our patient, we can use a magazine. Here, I have here a magazine. And then we are going to ask our patient to read the magazine for about 14 inches distance from the magazine. Okay? So, Mrs. Tia, kailangan nyo pong basahin ito. May papabasa lang po ako sa inyo. And kailangan nyo po siyang basahin galing po dito. Okay, so ito po.
Bactivivores. While some organisms consume plants, herbivores or animals, carnivores, some microscopic organisms ingest bacteria to get their nutrients as well as energy.
Okay po. So as we perform those assessment or the assessment, the patient has still a normal and great near vision. Then therefore, we are now going to assess the distance vision of our patient by asking her to read the Snellen chart. So in using the Snellen chart, we need to be 20 feet away from the Snellen chart to have a proper assessment. And then we are going to ask our patient to read the Snellen chart with both of her eyes, and then also with only the right eye and also the left eye of the patient. So we are going to use a card here, a small card, to cover later on the left eye or the right eye of the patient as we assess only the right eye and left eye of the patient. So Mrs. Tia, tayo po muna tayo, okay? Dito po tayo, okay, harap po tayo doon. Magbabasa lang po ulit tayo. So again, remember, in reading a Snellen chart, it should be 20 feet away. But since due to limited space right here, since we only have a limited space, we will just assume that it is already 20 feet away from the Snellen chart. So the first thing we need to do is to ask our patient to read the Snellen chart with both of her eyes. Okay po?
E, F, V, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C, L, E, F, O, D, P, C, T, F, D, P, L, T, C, E, O, P, E, C, O, L, C, F, T, D.
Okay? So far, the patient doesn't have any mistakes by reading the Snellen chart in both of her eyes. So right now, we are trying to assess the right eye of the patient first. So, tatakpan po muna natin yung left eye nyo. Okay? Hawakan po natin to. And then, pabasa po ulit.
E, F, P, T, O, C, L, P, E, D, P, E, C, F, D, E, D, F, C, C, P, F, E, L, O, P, C, D, D, E, F, P, O, T, E, C, L, E, F, O, D, P, C, T, F, D, P, L, T, C, E, O, P, E, Z, O, L, C, F, T, D.
Okay? So far, upon assessing the left eye of the patient also doesn't have any mistakes upon reading the Snellen chart. So lastly, let us check for the left eye of or the right eye of the patient. So we are going to cover the left eye of the patient. Okay po, cover po natin yung left.
EFP-TOC, LPED, PECFD, EDF-CCP, FELO, PZD, DEF-POTEC, LEF-OD, PCT, FDP-LT-CEO, PEZOL-CFTD.
Okay po. Okay, so upo na po ulit tayo. So far, as we perform the distance vision of the patient based on the Snellen chart, the patient has read all the alphabets within the Snellen chart with both of her eyes as well as with only the right eye or with only the left eye. So therefore, the patient still has a good distance vision. So maybe it is because we are not following the specific measurement, because usually the proper measurement or the proper distance of the patient from the Snellen chart should be 20 feet away. So maybe that is one of the factors why the patient has also been able to read all of the characters within the Snellen chart. Moreover, we need to also remember in performing the near vision and the distance vision test, we can also ask our patient to wear any of their glasses or correctional glasses if ever they have those. Because in that way, we can also assess if the patient's glasses are still appropriate for the grade of their eyes. So after that, that's the complete eye assessment or the eye structure and visual acuity test. And that's it. That's the end of the physical assessment. Again, I'm Mary Patricia Tria from BSN 14 and thank you for watching. So don't forget to record all of the assessments or all the results of the assessments on the record data or the chart of the patient. And then after that, of course, we need to explain to our patient everything we have assessed and of course, ask for any questions. So Mrs. Tria, tapos na po ang ating assessment. So again, if any po may questions po kayo sa akin, pwede po kayong magtanong. May questions po ba kayo?
Wala po.
Okay po. So far, naka-record na naman po siya dito and mamaya po, ibibigay na lang po natin siya sa inyo pong doktor. Okay po?
Okay po.
Okay po. So again, that's it. Again, I'm Mary Patricia B. Tria and thank you for watching.